Hey, I'm John Marshall. I'm the owner of Suncoast NPI TV, and we're back. And I'm very excited to have Dr. Dan Tuttle sitting next to me. And as you guys have heard, we don't accept anybody in Suncoast NPI. And then, folks, as the owner, I'm always more interested in the member than the membership check, and it's seat specific. So we're looking for folks that are actually rock stars in the category, and that's definitely you, Doc. And people that have a servant's heart that are always interested in giving back, and that's you, and committed to the commitment to make these chapters thrive. So I'm delighted to have you as a member, and I'm excited to have you on the show today. And this is all about you, Doc.
Oh, I'm excited to be here.
Yes. So let's do this. Let's have some fun.
Let's have some fun.
Yeah. So, Doc, I mean, I know you a little bit, but all these folks out here, tell us, who are you?
Who are you? Well, I'm this guy. I grew up in Massachusetts. I lived there the first 23 years of my life. Then I went to Chicago for a bit. I got a degree there. Then I lived in some other places in New England. Then I went to Atlanta, and then I got another degree there.
Another degree.
Another degree. So I got a couple degrees, and then got tired of Atlanta. Sorry, traffic, no good, and said, "Hey, Florida."
Yeah, at the outer loop, and the outer loop.
Yeah,
that's enough.
Yeah.
I hear you.
So it's me. I got a wife. I got a little dog. She's very cute, and life is good.
That's awesome. How long have you been in Florida now?
How long have I been in Florida? Almost 2 years.
2 years. Well, welcome.
Yeah.
Welcome.
Thanks.
We love Florida. We moved here from California.
That's right.
So, how did you get to here today? You want to talk about and lean into? We're going to tee up Tuttle Health.
Yeah.
So, kind of walk us up to it.
So my first postgraduate degree was a master's degree, and that's where the licensed psychotherapist thing comes from.
Yep.
Right. So I did that, and I've been doing that now for 15 years. Right. So I've worked in mental health. I've worked with people in outpatient settings, doing psychotherapy, and then going on and doing something called neurofeedback, which we'll get to in a few minutes.
Yep.
And I did that, and I worked, mental health, and then I got more interested in the body.
Right.
Right. So I went ahead and went back to school and got a doctorate of chiropractic. And I had always been a fan of chiropractors, and they had helped other people in my family. Got a guy to walk. Wasn't able to before. And then the chiropractor I worked with did cranial technique, something else we can talk about.
Yep.
And that really just amazed me at how awesome it was. And so I just got all into it and went back to school. And that's enough, though. No more school.
No more school.
No more school.
I don't know.
I don't know. 5 years, I might be going. No.
I have to tell you. I mean, I've done a lot of these, and I'm real excited about this because you bring a lot to the table, and it's really cool. You want to talk about Tuttle Health?
Sure. Tuttle Health has my name in it, and it's my business. And there we do psychotherapy, neurofeedback, and I'm a chiropractic physician, so we do a lot of chiropractic stuff.
Yep.
So it's a fusion. I have 2 licenses and 2 degrees. Some people come and see me just for chiropractic. Some people come and see me just for neurofeedback. Some people come and see me just for psychotherapy. And then I have people who I do a combination of these therapies with. Right? So it depends on the patient need. And I don't push anything on anyone. It's what they want. It's all about them, right? And what they need. If you just want me to fix your back, great, I'll just fix your back. You want me to do more? Let's do it.
That's awesome. So I think you've kind of already set this up, but what differentiates you and Tuttle Health within the marketplace?
Right. So I'm not just a chiropractor. I'm not just a therapist. I'm not just some guy doing neurofeedback. I'm a guy who has experience and skills in all of these areas. So I have a very large toolbox that I can sort of break out and be like, okay, I think you need this. I think you need this. I don't think you need that. Whatever suits the person, again, based on the individual.
Gotcha. No, I appreciate you sharing that. And so I think a lot of people probably have a misconception of what I'm getting ready to ask. Chiropractic. What actually is chiropractic?
Right. Well, so chiropractic puts a large emphasis on the spine, the musculoskeletal structure, and then the style of chiropractic I use also puts a big emphasis on the cranium. And then not to get all technical, but cerebrospinal fluid.
No, let's get technical. Let's go there.
Well, I don't want to bore you, John. But so the very big emphasis on that. I also am very aware of the muscles and the muscles in the body, right? So there's sometimes chiropractors get sort of pigeonholed and all you think about is the bones. It's like, no. The modern chiropractor looks at the bones, the muscles, the whole system.
Gotcha.
Right? Look at the whole person, the whole physiology, all of that.
Right.
So chiropractic is like the largest alternative healthcare profession, and there's a good reason for it.
Right.
So
that's thank you for that explanation. So, and then the other thing is like, do I need to go in there and get my back cracked? That's what, you know, a lot of people say, I'm going to crack that back.
Right. So, okay. So some people, I get a variety of people in my office, and some people come in and they say, just crack it right here. And other people say, all right, you can do anything except crack my neck. So, I mean, and I get this day in and day out, right? If you're someone who's scared of going to the chiropractor, if you're afraid that they're going to crack your neck, you don't like the sound, whatever, I don't ever have to do it.
Gotcha.
Right?
Okay.
I do styles of chiropractic where we don't ever have to make any noise like that. Now, that said, that's the first thing they teach you when you're in chiropractic school is, this is how you make, this is how you adjust a vertebra, and yeah, it's going to make some noise. So again, depending on what the person wants. And so I practice a couple different, what are considered lower force forms of chiropractic.
Okay.
One of them is Sacraloccipital technique. Oh,
that's a mouthful.
That's a mouthful.
When we stay there for a second, what the heck is sacraloccipital technique?
So a little anatomy lesson, John. At the base of your spine is your sacrum.
Okay.
And then at the back of your head is your occiput.
Okay.
Right? And so the guy who developed this was another guy with a lot of degrees. He had a degree in chiropractic. He had a degree in osteopathy. He's a mechanical engineer. And he realized that there was this relationship between the pelvis, which the sacrum is part of, the sacrum, the pelvis, and then the cranium, and the occiput is part of the cranium. So he realized there was this relationship between the two, and that you really needed to balance both to have not only the spine be in line, but then the cranium, and then so it's all about looking at the whole structure. And then sacraloccipital technique also looks at the extremities. So your feet, your ankles, your knees, your hips, you got problems there, we deal with it. We address it. Shoulder problems, elbow, golfer's elbow, tennis elbow, one on one side, one on the other. Carpal tunnel, all of that is all looked at, and so again, it's very comprehensive, it's very, very holistic.
Wow.
And it's also very low force. There's some wedge-shaped blocks that you can place under the pelvis. The person just lays on them. It's very gentle, it's very safe, and it's also very effective, because sometimes you can have problems where you really don't want to be cranking on a joint, right? Especially in the pelvis. Sometimes you just need to let it find itself back into place. Yeah. So that's a big part of what I do. So people love it. People say, wow, I've never had this done before. This is incredible. I feel amazing. So, So that's one of the things I do.
And I appreciate spelling that out in terms that I and the listeners can understand. So I appreciate it. So you want to talk about another one?
Sure. So then there's another one I do called cox flexion distraction.
Yes.
Right? And so this is another one for people with disc problems, sciatica, low back pain, or if you just want a really good stretch. What you end up doing is it's a table. Okay. And then the bottom of the table, it tractions out like this, which everyone's heard of traction. Right. But then the other piece is it goes down like this. And so you put the lumbar spine in the flexion. Okay. And then what you do is you have another hand here, and you're kind of opening up the disc space, and you're opening up the facets, the little openings where the nerves come out of in the low back, right? So you're opening everything up. This is one of the most studied forms of chiropractic out there for low back pain and sciatica, right? And I get fantastic results with it. And of course, a guy like me comes along, and I'm doing that, and then I'm doing the sacraloccipital technique too. Wow. So first we're stretching, then we got them on the blocks, and so we get this comprehensive approach to go in to get people better as fast as we can. Gotcha. And all of that's really gentle. So, you get a hot sciatica person, it's like, oh, don't touch me, and I can barely get on your table. But all of this is really gentle, safe stuff. So
that's solid. That's solid.
Times.
And I know we have just a couple minutes, and I know we could do this for an hour.
Oh, I could talk forever, John.
So I know we want to tie in. Dig into neurofeedback.
Neurofeedback, right? So, neurofeedback is different. So we have a brain,
Yep.
And then we have neurons in the brain, and they fire off, and you get enough of them firing off, and you pick up an electrical signal, and you can pick it up on the scalp, and that's an EEG.
Okay.
And that's the thing. You go to a neurologist. We're going to run an EEG. Okay, that's an EEG. It's the same equipment, same stuff in my office, medical grade equipment.
I've seen it.
You've seen
Very
it.
cool.
You've been there, right? So we hook them up. If a person has an issue, right, and the issues that we deal with, post-traumatic stress disorder, ADHD. I've treated hundreds of kids with ADHD successfully. Anxiety, depression, insomnia, autism, any of these sort of brain-based, obsessive-compulsive disorder, any of these brain-based conditions,
awesome.
right? People have been in therapy. I've been in therapy 12 years talking about my depression. Well, maybe there's a brain-based component to it that needs to be addressed. And that's what neurofeedback is. So we record a brain, and then we compare it to a normative database, which is a group of people who don't have any of these disorders, who have been screened. And then we see what parts of the brain aren't working right.
Right.
And a brain that's functioning differently is okay. But if that area that's functioning differently relates to the problem that the person has, then that's something we can change.
Interesting.
Right? So a person got ADHD, well, we're going to look here. We're going to look here. We're going to look in areas that relate to ADHD, and then we're going to say, okay, wow, we can change that. And so that's what I do.
That's amazing.
Right? And the nice thing about neurofeedback is you do the sessions, and then once you're done, you're done.
You're done.
You're done. There's no more pills. There's no more, you take this for the rest of your life or all that. It's just, boom, done.
That's great. We got like 30 seconds or so. So is there something you want to close out with? Some point you want to end with today on today's session? I definitely would love to have you back.
Yeah,
I mean, you bring so much to the table.
So much to the table. Well, again, just for people to understand that, I offer a lot, and it's really based on what the person wants and needs.
Yeah.
So I really hope people understand that they can come to me with a variety of problems, and that I'm happy to help in whatever way I can. And, I also work with other professionals. So if it's something that I say, you know what, I know a lot, but I don't know everything, let's send you to this guy. I love working with other people.
That's great. That's great, Doc. You're a delight to have as a member. Appreciate you.
Appreciate you.
Got to go.
Gotta go.